I thought Minister Phaahla would sit here and we sit to the center of the cameras. Thank you. Good afternoon, colleagues. Thank you so much for your time. We apologize, we are slightly late, but we're ready to start. This is a social cluster media briefing, and it is co-chaired by DBE as well as Department of Health. And today we have the Ministers of Health as well as Basic Education. I'm now going to ask the Minister of Health, Dr. Joe Phaahla, to come through to take us through the statement as it reflects the work of the cluster as a whole for this afternoon. Thereafter, we'll go to question time, and the ministers will be able to give each other an opportunity to answer some of the questions that you might have. Minister Phaahla, over to you.
Thank you very much, Mr. Mhlanga. Greetings to my colleague, Minister of Basic Education, Minister Motshekga, and good afternoon to members of the media. As already indicated, we are here not just representing our departments, but representing the social cluster within the cabinet. This briefing is premised on the back of the State of the Nation address by President Ramaphosa. And in that State of the Nation address, amongst others, the President mentioned, I quote, that the social economy, including early childhood development, nursing, social work, community services, have a significant potential not only to create jobs, but to provide vital services that communities need, close quote. To this end, the social cluster is committed to taking forward the implementation of interventions aimed at improving the socio-economic status and lives of South Africans. One such intervention, very key, is the Presidential Youth Employment Initiative, which is being implemented by a number of departments, but very key to that is the basic education sector, which has created as many as more than 570,000 employment opportunities between the ages of 18 and 35 years old in the past. Now, in the 2022-23 financial year, as you would remember that the minister did make allocation to the Presidential Youth Employment, government has set aside support for job creation, including the creation of employment opportunities for youth. And in the basic education sector, 6.19 billion rand will be allocated to implement what will now be phase 3 of this Presidential Youth Employment Initiative. Now, through this funding, the sector will create 250,000 job opportunities, that is in the phase 3. This is for young people who are most affected by unemployment. As we know, young people are really suffering from unemployment. This means that by the end of the financial year 2022 and 2023, that is by end of March next year, the sector would have provided cumulatively 800,000 employment opportunities for young people across the country. The impact of this program is significant as there is a school in every community, so various communities across the country will benefit, as it's been the case already, meaning that the benefit will be felt right across both urban and rural areas. Just in terms of phase 2, which is ending March this year, and then as the phase 2 will be ending, phase 3 will kick in immediately. And then the Department of Basic Education will be able to communicate further details in this regard. With this kind of training, government would like to ensure that young people, when they leave this initiative, they will have gained various valuable experiences and skills, so that this can really be a door opener for future careers. In addition, the Minister of Public Works and Infrastructure has also awarded bursaries to learners enrolled in courses in the built environment area. The aim of this scheme and the program is to bring more skilled professionals into the built environment. The program is also aimed at removing financial barriers by providing funding for disadvantaged students to access the built environment qualifications. These bursaries will accommodate, amongst others, the following areas: electrical engineering, mechanical engineering, civil engineering, marine engineering, property studies, real estate, that is properties and real estate, actuarial science, quantity surveying, construction project management, and landscape and architecture, and also town and regional planning. Government is acutely aware of these sectors having a very low representation of women and also persons with disabilities. So there will be a specific focus to accommodate disadvantaged groups. And so government will continue to make more opportunities for these target groups to improve more representation in the workforce. Over and above that, the Department of Higher Education and Training will offer approximately 100,000 opportunities, including but not limited to learnerships, which provide both theory and practical experience in the workplace. Learners will be paid a learnership allowance regulated in terms of the national minimum wage, including apprenticeship in this area. Last year, in April, the government increased apprenticeship learner grant from 165,000 to 206,000, paid to employers hosting apprentices for the duration of the various apprenticeship. This was done to encourage employers to turn their workplaces into training places. We'll also be prioritizing a minimum of 10,000 TVET students who will be placed also in various sectors of the economy in collaboration with the SETAs from the 1st of April this year. This is taking forward work of the National Skills Accord and the Youth Employment Accord, which was signed quite a number of years ago, 2011 and 2013, where companies committed to placement of 12,000 placements or internship places available for students who complete their certificates in the TVET colleges. In the area of critical skills, the Department of Higher Education and Training and the Department of Home Affairs have signed a memorandum last year in January to facilitate the development of critical skills list. The list has been a subject of public debate in the recent weeks. Various commentators know, even from my own sector, from the health, there are those who are not happy that generally medical practice is not included in the critical skills, but we can speak to that. Now, we're here to announce that the list will officially become available during the course of today, and we can have more details from the Department of Higher Education. In the area of human settlements, we are sharpening the focus on the main priority, which is transformation of the human settlements into livable and sustainable spaces through spatial targeting and consolidation of investment. This is being done in reprioritizing the program to focus on upgrading of informal settlements, integrated residential development, and significant increase in affordable rental housing stock. One of the most important pillars for this government is transparency. So in order to restore confidence in this area of work, the Department of Human Settlements will digitize allocation of houses so that everyone can be able to know what their status are because as you know, currently there's always accusation that people, one day you are top on the list, tomorrow you find that you are no more in the list. So this is being addressed by the Department of Human Settlement, making sure that this is digitized so that people, there will be a website where you can be able to check in and find where you are in your area. This will be done through a digital system that is accessible, that will eliminate corrupt activities in allocation of housing opportunities. The department will accelerate also the issuing of title deeds throughout the country as a way of restoring the dignity of many South Africans, because there is no better dignity than having a property of your own, especially a house you live in, knowing that it is yours and registered in your name or in the family's name. In the health area, as you know, vaccination remains our main weapon in the fight to mitigate against the impact of COVID-19. So the vaccination program is proceeding very well. Now, although the uptake has not been of late in the last few months, I would say essentially as far back maybe as around October last year, there was a dip in the uptake, which would rise when there is a new wave. When the fourth wave came in, there was a rise in uptake. But the more people hear that this is not so deadly, that people are surviving, staying shorter in hospital, then you find that the uptake is reducing. And of course, a lot of other stories which people hear and some believe. But the coverage has moved steadily. And at the current moment, in terms of the adult coverage of at least one jab for an adult individual, we're just under 48% coverage, at 47.7% of the adult average population having had at least a dose of the vaccination. In terms of the total number of doses already administered as of yesterday, just over 31.2 million doses already administered. So we still have our aspiration, and we emphasize again that we do have the capacity to provide this service to 70% of the adult population. All that is required is for people to come forward. We know that our population is dominated by young people. When you talk of the average, or when you talk about the adult population, more than half of the adult population is actually between the ages of 18 and 35. So when we speak about covering 70% of the population, we need to cover much more young people, because the older population has come forward in big numbers. If you look at the over 60, the over 50. So, and we are happy that the young people have taken their own initiative. As many of you would be aware, some of the media were present last Friday here in Tshwane, when the young people launched their own initiative in terms of mobilizing their peers to take up the vaccination. So our drive to get more young people is now in the hands of the young professionals, young doctors, and youth generally. We have said that as a department, we are only there to support and give all the information, give all whatever they need, whatever facilities they need. But they must, the young people now, it's in their hands, and it is showing. There's a very promising sign. Over this week, we have seen a little bit of rise over the last few days, from just under 70,000, over 70,000, and just yesterday, just a little bit under 90,000 uptake. So it looks like the campaign by the young people by themselves is actually gaining ground. So we want to take this opportunity again to urge South Africans, especially our young people who are lagging behind, that this is the time. As much as the infection rates are lower by now, the numbers in hospitals and people who are very sick is lower, but we all know that this is very unpredictable. The scientists are telling us that the fifth wave is on its way. We don't know how it's going to be. We're optimistic that it might, even if it's a highly infectious, hopefully like Omicron, it might be milder in terms of severity of illness, but we don't know. But ultimately, in terms of opening up the country, the only weapon is vaccination. All the countries which have opened up now, doing all sorts of major activities, sporting, cultural, they have achieved 70% of their vaccination. So this is what is retarding us. On the national state of disaster, this is also quite topical, as the president announced in the SONA that we are working on exiting the use of the state of disaster. Various departments are working on alternative measures to replace the state of disaster. The National Health Department is leading in that regard. So we are working on our health regulations, making sure that we can have enough protection measures through the National Health Act and its regulations to replace the state of disaster, the Disaster Management Act. We almost at the tail end of finalizing this matter, and it will be reported to the national coronavirus. We are hoping, we not yet have confirmation, but hopefully by next week there should be a coronavirus council where this regulate the health and other departments' alternative regulations can be presented. From the health side, these regulations will cover surveillance and control of notifiable disease, public health measures at points of entry, management of human remains, and also environmental health. So this should be ready to be presented to the Coronavirus Council in the course of early next week. We have, from the health side also, a lot of work has to be done to recover from lost ground in terms of other health services. As you would be aware that right from the lockdown, as we've been recovering, every time there's a wave of COVID, it means that health services reprioritize from doing normal operations, for instance, surgery for broken bones and other surgeries, what is called cold surgery which is not urgent, not for trauma and so on. All of those get postponed. And we have lost ground in terms of TB, in terms of HIV, even in terms of family planning. Minister Motsekga, it's not surprising that young people getting pregnant because of COVID, too much focus on it. Even family planning services have lost ground. So all those are now being focused. Even other vaccinations, we find that in some areas, even vaccination, for instance, for HPV, human papillomavirus, for prevention of cancer of the cervix, all those have gone down. So we need to catch up again. So all those, just to assure South Africans that as our health services recover from the pressure of COVID, we are making sure that we can recover other services. Just quickly on the National Health Insurance, you would know that the committee, the Portfolio Committee on Health in the National Assembly is busy with oral submissions. There have been oral submissions to the Committee on the National Health Insurance Bill. From the department side, we are waiting for the committee to be for them to call the department, so that once they've wrapped up their hearings, then there will be questions which they will expect the Department of Health to answer. But we are optimistic that the parties in Parliament, majority, will support the bill so that we can lay the foundation for universal health coverage. Just quickly on the typhoid, there has been reports, some of the reports also fake news about typhoid fever. Typhoid being a disease which affects the gastrointestinal tract, which can cause severe fever, abdominal pain, in some instances also diarrhea. Now, largely this disease is spread through contamination in water, but also handling of food when people who might be carrying this bacteria called salmonella, if people who are preparing food, if they have not done proper hygiene. And sometimes it's also, salads and uncooked food, which is not which may come into contamination. But there has been some misguided news that our municipal water is contaminated with this bacteria. I want to say here and now that this is totally untrue. Typhoid is endemic in South Africa, and what it means is there is always some small breakout of typhoid. Whenever there is a problem with the sewer systems where things are not properly managed, then when the sewer spill into the water in some areas, then you will find this typhoid coming up. Some of you may remember around 2005 there was an outbreak in Delmas because of water contamination. So at the current moment, what the National Institute of Communicable Diseases indicated is that over the last 3 years, from 2020-21 up to even now, there's been pockets of this disease being picked up, much, very, very small. On average, it's been less than 200 of such cases in the whole country in a year, and in particular areas. So in some areas, you will find that, in fact, I think in the last year, there were less than 150 cases. So you will find 3 here, 4 here, and so on. So they found some cases in some areas in the Johannesburg metro, in some areas, I think there were some areas in Gauteng, also in some areas of Ekurhuleni. There was Northwest also. Some areas of the Western Cape, in the Cape Metro, there were some isolated areas. But even there, we're talking about where you can actually identify to say it is in this area. And then it can be followed up as to what is the cause. But what we want to emphasize is that there is no kind of public risk in terms of contamination of drinking water through some of our suppliers. It's very isolated, where either food or some food handlers maybe and small areas of some water areas, but not in the municipal pipeline. There was a message which said that don't drink tap water. It's got typhoid. I want to say that this is definitely not true. In the area of the ECD, I'm sure many of you are aware that the decision was taken to move early childhood development from social development to basic education. I'm sure Minister Motshekga can add more to that. That process is going on smoothly. So the two departments are really working together in making sure that this function, can be strengthened, and the migration to basic education will work in favor of, the continuum of childhood development and education. So we just want to indicate that that is progressing very well. I've already touched when I spoke about our problems in terms of COVID dominating, about even losing on the family planning. The basic education has launched a policy on prevention of learner pregnancy in the schools. Now, there were recent statistics which were indeed worrying in terms of pregnancies amongst the children aged between 10 and 19. I think in some cases they even quoted below 10, where some real children actually fell pregnant. So the Department of Basic Education has launched a policy for the prevention and management of learner pregnancy in schools. Through this policy, we are on the continuous engagement to make sure that this can be managed properly. There is a continuous engagement with other sectors and significantly very important parents to strengthen the prevention of early and unplanned, unintended pregnancy. Interventions such as Let's Talk on this program is implemented also through the support of UNESCO. This allows open, safe spaces of intergenerational dialogue on how we collectively we can best work together to prevent teenage pregnancies. So our commitment is to strengthen comprehensive sexuality education as it's being offered in life orientation, to ensure that learners are empowered with knowledge and skills to make informed decisions about their health and sexuality. prevention of sexually transmitted disease, including HIV and also pregnancy, so that they can be able to focus on their education. Where early pregnancy does occur, the policy will help the sector to support the pregnant learner and ensure that care and support is provided, so that the unfortunate occurrence does not impact negatively to their education. You know that many, unfortunately, because of the nature of pregnancies, only the girl in the partnership who carries the baby. And unfortunately, the girls are the ones who suffer and end up dropping out of school. So through this intervention, we're hoping that this will be very, very much limited. We call upon parents, caregivers, and community members to help in ensuring that children are protected, especially because most of the time, the pregnancy amongst children occur as a result of sexual abuse and coerced sexual activity. So the government alone will not succeed if parents and community doesn't come to the party. In as far as combating of GBV and femicide, government continues to intensify response to GBV and femicide through implementation of the National Strategic Plan, and as part of the National Strategic Plan, measures to promote the empowerment of women. The President has signed into law new pieces of legislation which have strengthened the criminal justice system, promoting accountability across the state and also supporting survivors. The implementation of this legislation will go a long way in ensuring that cases are successfully prosecuted, that survivors are protected, and that there are more effective deterrents in place for perpetrators to be deterred from continuing with this. However, the fight against GBV will never be won unless all of society is mobilized and all formations and all citizens are behind the program. Ending GBV is a collective responsibility and takes social compact that ensures safe spaces and communities and safe communities for women and children. The Department of Public Works has so far handed over 12 properties for use as shelters for GBV victims. The properties were handed over to the national and provincial departments of social development. Furthermore, a total of 14 other properties have been inspected and they are being refurbished so that they can also be handed over for this purpose. Behavioral change and toxic masculinity must continue to be called out and ostracized as we work towards a more just society for women and girls. So we welcome the appointment of Chairperson Nkosikazi Mhlauli as a leader of the House of Traditional Leaders and traditional and Khoisan leaders to drive this campaign in the communities. In the area of social protection, our social protection system is amongst the greatest achievements of our democracy since 1994. As you know, this reaches more than 18 million South Africans. Of course, others get concerned as to whether we can sustain this. Of course, the job creation efforts are also to reduce the dependence on social protection. Since the onset of COVID, the Social Relief of Distress Grant has provided support to more than 10 million unemployed South Africans who remain vulnerable as a result of the pandemic and also just unemployment overall. As much as it is quite clear that this may not be sustained on the long term because of the recognition that there is extreme poverty, this social relief for distress has been extended, as you had the President announcing and the Minister of Finance. But we know that this is a very tight fiscus, so it's a very tight balancing act. So it's very important, as the Minister of Finance said yesterday, to balance this, make sure that jobs are created so that there is not continuous dependent on the grants. But mindful of the current situation, as you would know, this, as I've said, this has been extended to another year, which will end in March 2023. Now, during this time, a broad consultation will ensue on the technical way to look at other options rather than this grant. Future support must also depend on the affordability and must also make sure that it is not at the expense of other basic services. So it remains our ambition to establish a minimum level of support for those who are totally left out in terms of our economic situation. As we move to conclusion, we are really distressed about the accidents which continue to happen on our roads. And one of those very bad ones is where this morning 9 children were being buried in Mpumalanga as a result of a really terrible accident of the vehicle which was carrying them to school. The children died on their way to school when the vehicle crashed on a bridge into a river in an area called Mpuluze. We take this opportunity to convey our condolences to the families and relatives of the children who are deceased. This is another reminder that as a country we need to do more to protect our children who perish unnecessarily, particularly on their way to schools. We need to work together collaboratively to protect children until they grow to be adults, to realize their full potential as citizens of our country, and that they should acquire the skills which will contribute meaningfully to the development of the country and to their own personal development and to support their families. Ricardo Muziwendlovu Makado, known professionally as Ricky Rick, was a South African rapper, songwriter, singer, composer, actor. Unfortunately, also passed away just yesterday. Our condolences also go to the family and friends of the rapper, and we say may his soul rest in peace. Now, we want to say, as I conclude, that the issue of mental depression, depression, I think many of us are slowly coming to terms that depression is a major epidemic, in our country. And unfortunately, it's something which amongst many of our communities, we don't really talk about. And especially men find it very difficult to talk about, depression. So we want to take this opportunity to say again that we must learn from the sad passing of some of our luminaries, high-profile South Africans. It's a reminder to all of us that it should not be a shame, to report that, when you feel that you're not okay, that mentally not well. Report, seek professional help, because that's the only way in which we can be able to save life. Thank you very much, our program director.
Thank you so much, Minister. I think we'll go straight to questions now, because we don't have much time. We know that you've got parliamentary responsibilities at 2 o'clock. So we'll go straight to the questions. Ishmael, do we have any questions on the WhatsApp line? And thank you, let's go.
We have one question from Makali from Business Day. Minister, critics say the health department should focus on vaccinating the most vulnerable section of the population, those over the age of 50, rather than going on a drive to reach more young people who are far less likely to be hospitalized or die from COVID-19. How do you respond to this? That's all for now, Chair.
All right, great stuff. Any questions in the room here? Okay, no, we don't have. Minister, I'm going to ask you to respond to that question.
Our approach is not an either or. Our approach is that what we seek is to protect the South African population. We have an opportunity